Hello, and in today's episode, we are going to discuss palpation of the acromioclavicular joint. Here we have through our tracing, we know where we are, and we want to travel understanding exactly where the borders of the clavicle are from a proximal to distal direction until we hit the end of the clavicle. Now I would put one finger there so you don't get distracted. And now we're going to follow the spine of the scapula, which is fairly prominent. And by going on either side of the spine of the scapula, we could follow it all the way to the distal end of the shoulder, and we feel it curving around. That now becomes the articulation between the acromion process and the clavicle. It's important here that we realize that it's not necessarily so easy to feel the joint as there are a lot of ligaments. It's also important that we don't put too much pressure, because somebody who has an AC joint injury is going to be pretty tender or potentially pretty tender here. So we are here just trying to find our landmarks. And here is the acromion process, in particular when we go from the proximal end to the distal end. And right at the end here, we can start to feel the rotated cuff and the deltoids. So the articulation between the acromion process, moving in the joint, and then to the distal clavicle. And now we have palpated the acromioclavicular joint. Thank you.